So welcome everyone. We are immensely pleased you could all join us today for today's presentation, Taking Control of Your Dystonia, a Physiotherapy Focus. The session today is part of our Reach Out, Reach All series. We launched the project towards the end of 2019 via crowdfunding, and we are thrilled to have been able to bring you the content already. The aim of Reach Out, Reach All is really to do just that, to reach more of the dystonia community and find new ways to deliver content. And we have shown with the first of these webinars that they have the ability to reach a massive audience of dystonia patients throughout the UK and actually even the globe. And we're so excited to be presenting the second in that series today. We'd like to take this opportunity to thank Merz Pharmaceuticals for their involvement in today's project. We are incredibly grateful for all of their support in putting together today's event. This session has been planned to help empower dystonia patients through learning and implementing of new techniques with a physiotherapy focus, and we are delighted to have two fantastic speakers to talk on those topics, Richmond Stace and Sally Glover. Our first of today's two presentations is from Richmond Stace. Richmond, to tell you a little bit about him, is a specialist physiotherapist with a background in pain science, rehabilitation, nursing, sports science, and coaching. And he has blended these fields of expertise to pioneer a strengths-based coaching approach for both chronic pain and dystonia. His clinics are in London and Surrey, and he also works with people on Zoom and Skype across the UK and the globe. The coaching he delivers focuses on the person, their strengths, and their potential to improve their life in specific ways using practical tools. Using his coaching lens, he helps you to understand your experiences before then practicing specific sensory motor training techniques with a range of exercises and strategies. His sessions focus on you and on what you can do now to shape a positive future. So without further ado, I will hand straight over to Richmond.
Now there should be a little picture of me in the top right hand of your screen and a slide, but of course I won't get any feedback, so if you've got any problems, do email as suggested. Meanwhile, let's just get this up here. Okay, just a quick disclaimer just to say that the things that we're going to go through over the next sort of 15 minutes or so, the tips and tools are not a replacement for your treatment. If you've got any specific questions, then do email in. If you're unsure, it's always wise to check with your healthcare provider. Okay. So what we're going to do over the next sort of 50 minutes or so is just to build on things. So give you a little more understanding, give you a few options of things that you can do, and hopefully increase your sense of control, which is very important for any condition, feeling that you're more in the driving seat than a passenger. So I'm just going to give you a few seconds to grab a pen and paper, because although you can see me and I can't see you, I'm going to try and make this slightly interactive. If you've got a pen and paper, that will help just to write down a few things. I am going to produce a worksheet as well, which you can come back to and use if you come and watch the recording again at a later date. But just see if you can grab a pen and paper. And in the meantime, just very briefly, how did I get into dystonia? It was really with a conversation with Marie-Helene Marion, who was on the previous webinar. And we met up and we were chatting about various things. And there was a lot of similarity. And what we realized was that I was talking about pain and pain science, and she was talking about dystonia and this kind of these common features that we were discussing and describing really brought us together, thinking, well, hold on a minute, maybe there's something we can do here. And that was a few years back now. And since then, we've seen many patients together. And really what we're aiming to do is to improve people's quality of life, or help them to improve, or help you to improve the quality of your life, and you feel in control of that process. And we're here to help in our different ways. Obviously, Marie-Helene comes from the medical neurology perspective, and I come from the physiotherapy and coaching perspective, which I'll go into. So that was really my journey into dystonia a few years back. And now here we are. So I'm going to present to you some thoughts and some ideas. Hopefully you've got pen and paper now and you can jot down things as we go. I just wanted to point out that, with most conditions, it's a bit like an iceberg. So the dystonia, if you like, if the experience of the dystonia, the movements that you feel, they're the tip of the iceberg. And beneath the surface there, you've got a whole load of factors that are playing a role in how you experience that. So we might think about genetics or past experiences, the environment you're in, your emotional state, your hopes, your dreams, and many, many other things as well. So to be effective in helping you to make changes, positive changes, we have to go beneath the surface. And of course, we can call it biology in the dark because we have no access to our biology. I have no access to my brain. And in fact, my brain has no access to my body. All my brain receives are these sensory signals, which it has to try and make some kind of sense of, or make an inference about, or make its best guess. So taking that into consideration, what we can think about the brain is it's a predictor. So these experiences that we're having right now are our brain's best guess about what's going on. As I said, the brain is receiving sensory signals from the body and from outside, but it has to try and make some sort of sense. So the world that we see and the experiences that we have and the movements that we make are all the best guesses based on what's happened before. And although that might sound a little more complex than just thinking that the brain just creates experiences, it actually opens up a number of opportunities. So what we don't want to do now is to really sort of separate the brain and the body, because it all comes together as the whole person. And I always like to make the point that whether it be pain or dystonia, or if you experience both, it's really the person that experiences those things and not the body part. And so too often the biomedical model will focus very much on the body part and reduce it down, as opposed to thinking, well, this is a person. So it's really got to be person first in the way that we go about it. So the brain needs a body to enact the predictions in the world. And in that sense, we can also think about the body as keeping the score of everything that we've ever experienced. And it's an incredible book actually called The Body Keeps a Score. And I have pinched the phrase because it's a useful way to think. How is my body right now? What's going on here? This is representative of my story, the story of my life. So we can start to put together some sense of the narrative, what's been happening, but then really focus now on what we can do to build on what works and to leave behind the things that don't work. Okay. So moving on, I just wanted to give a couple of examples of the type of neuroscience that I sort of delve into to help explain and create ways forward. So you might like to know that eye movement is very much related to certain phases of your heart rate. And so this is very recent work, and you'll see the reference there on the screen. So you think, well, okay, well, in blepharospasm, where there's clearly an issue with the way that the eyes are being controlled and the uncontrolled blinking, if you like, well, how is that possibly related to heart rate? What is your heart rate often like? What's your heart rate variability like, and how can we influence that? How can we change what's happening with blinking via changing what's going on with our heart rate? Think about heart rate going up when we're excited or stressed, heart rate coming down when we're more relaxed. Okay, how can I be more relaxed, and how can that possibly relate through to what's going on with my eyes? So that's just a very, very brief insight, I know, but it just to give you some sense of the way we can look at this much more broadly than drawing on the wide literature of neuroscience. We've got another example here with laryngeal dystonia. Again, if you look at the picture on the right, you'll see how the vagus nerve, which is largely parasympathetic, so restorative, and all those processes there that help us to energize, arrest, and heal. So all the calming stuff. So when you're feeling calm, you can think, yes, I'm in a more parasympathetic state. So you can see that there's a nerve supply that goes to the larynx and controls those muscles. So equally, you can think, well, if I'm stressed, then that's going to be more of the sympathetic nervous system working, which is going to affect my voice. And if you consider how someone speaks, it's a real indication of the sort of state that they're in and in fact what they're doing. Think about how we talk to children or animals, or if we're angry or upset. The voice tone very much changes, and we can also use voice tone to help other people. So, for example, using a very calming voice then will have a calming effect on someone else. As a therapist, you have to be very aware of that, because the way that that person relates to you can be very much driven by your facial expressions and your tone. So not just the language that you're using, but very much how you're using it as well, and how that can impact. So just briefly talking about the autonomic nervous system, which controls a lot of other systems in the body. You may have heard of fight or flight, which is largely the sympathetic nervous system, and that's very much related to protection. And so when we perceive that there's some kind of threat. Now, in the modern world, there's definitely a case to say that we suffer with threatitis. So we perceive a lot of threats. We're thinking about things in different ways. A lot of stuff going on at the moment to make us feel worried and concerned. And of course, that shifts us into this protect state. And that inevitably is going to have an effect on the voice. If we've experienced trauma in the past, and pretty much everyone experiences some kind of trauma and ongoing stress and ongoing protect through our lives, and when I see people who are suffering with dystonia, there's often some kind of story of stress or threat within there, then you can start to see how these things might manifest in different ways in individuals. So hopefully those two examples are just giving you some insight into how things happen, but also start to give you some idea about how we can move forward with it, because there are some very practical tools that we'll come to shortly that you can use to influence the autonomic nervous system and start switching towards being more parasympathetic, which we all need in our lives. And in some cases, we need a bit more than that. Sometimes we do need some help with counseling or other therapies as well. Okay, so just to pause for a minute, just so you can think about, well, what's this been like for you? What's your lived experience? What's your narrative? What's it like for you, and what's the impact on you, your life, and the people around you? And when you think about that for dystonia and pain, what we start to realize is that a lot of the suffering comes from disconnecting from things that are really, really important to you. So it might be people, it might be purpose, it might be the planet, i.e. getting outside into nature, and certainly the body. So for example, if you can't do all the things that you want to do because of some kind of the limitations that are caused by the dystonia, then we disconnect, and that creates its own form of suffering. There's a lot of literature on that over the years in different scenarios. But we also lose this sense of precision of how we move. And the analogy I often give to people is a bit like that driving game in the arcade, where it's fine when you're driving along and you're going straight, but as soon as you hit the curve, you oversteer one way and hit one side. And so then you oversteer the other way, and you never quite get that precision or economy of movement. And that creates its own loops going forward, the brain being a predictor, using that past experience to predict what's happening now. And we just keep weaving, losing that sense of where we are, losing that sense of control. And on we go until we start creating or trying to create a better model of sensory motor function. Now that's quite a big chunk of work that I do with people in helping them to retrain. We won't be able to do that here because it is very specific work. But sensory motor training is a fundamental part of moving forwards. So there are 4 key players here that I want to bring to your attention, and actually attention is one of those. So whether it be pain or dystonia, 2 of the big ones there. So expectation, what do you expect to happen? Now, when we expect something to hurt, it usually does and more. We know that. But we're not just talking about conscious expectation, we're also talking about expectation biologically as well. So again, what's happened before, the brain will use as part of that predictive process, part of your brain's expectation of what the world should look like based on the model that you've created over the years of development. So that's one big player. The second one, attention, most people realize that the more they put focus on the dystonia, the worse it gets. So when you're distracted, when your awareness is filled with something else, of something more important or something more interesting or with more meaning, then the awareness of what you're experiencing in terms of dystonia can then fade off, sometimes for long periods, sometimes for short periods. Of course, that will vary. So you can think of it a bit like this. you know, we have our awareness, and everything appears in our awareness, whether it be a thought, a feeling, a sound, a smell, a bodily sensation. It all appears in the same place, and we've only got a certain amount of capacity. So if you're really interested in a conversation with someone, or you're laughing or doing something else that brings you joy or pleasure, then you're much less likely to have this intrusion of the unwanted movement or the pain. So where your attention is, and you can learn how to maneuver that with certain practices. Your emotional state will have a huge impact on this, because what we're talking about, are you in a protective state or a state of flow, or a healthy state, let's say. And if there's a tendency to feel anxious and worried and stressed, then that emotional state is shifting towards protection, and then you get greater muscle tension, and then the movement's all about protection, and therefore you're much more likely to experience the stronger contractions. And then the fourth point is your energy level, so how tired you are. It can be exhausting having all this movement. So you're using a lot of energy to do that. But not only is there energy in the actual movements, you know, you have to start thinking about things you wouldn't normally think about, and that takes energy as well. And then some people will suffer with sleep issues, which has the knock-on effect in addition to that. So briefly, why coaching? Well, coaching offers a whole person approach, so it puts you right at the center. And we start off by realizing where you are, so the real self. We look at the ideal self, so where do you want to be? How do you want your life to be? And then we look at all the possibilities, all the different things that you can do, and there are many of these, to shape this positive future that you want to work towards. So your pictures of success and the real results you want to achieve, and the connections you want to make, and how to get there. So it's a process and a journey to go on. And as a coach, you're here, and I'm here as an encourager to have conversations with you, to help you understand things, and then to practice the tools which then you use in your world to make a difference. And that's really where it's got to make a difference in your world. And only you're the judge of whether you're getting better or not. So let's go into some practical tools. So I've just got a handful of these to go through. So the first one is to be very clear on where you're going. So there's a basic rule in life: what we focus on governs how we feel. So we really want to have some clear, positive future images of where we're going, and to be using conversation and language that steers us in that direction. Now, of course, some people will say, well, I don't want pain, or I don't want dystonia. But of course, that's like saying, don't think of elephants. So the very thing you'll be thinking about when you say, I don't want dystonia, is dystonia. So it's more thinking, right, I want to go back to work. I want to be able to play sport. I want to be with the kids. I want to be able to go shopping. I'd like to be able to do my hair, you know, whatever it happens to be. So we want to frame it very much on what we want. And that's a discipline and a practice in itself, is to keep focused on that. So if you can clarify and think about how you want your life to be and what you're going to work towards, that's a great first step to take. A second tool that I often use with people is to think about things that bring you joy and pleasure. So it could be music, it could be reading, it could be watching TV, it could be being out in the garden. It doesn't matter what it is, as long as it's something that brings you pleasure and joy, which is a state. It's a state of being well, it's a state of health. So if you can make a list when we finish of 5 things that bring you joy, and what you can do while you're writing those down is just to pause and immerse yourself in the picture of that. So really think about those things and notice what happens in your body when you think about it, remembering what you focus on governs how you feel. If when you're focusing on it, you start to feel anxious, worried, or something else that you would deem to be not an abnormal, but an unpleasant sensation or emotion, that's because you might be thinking, well, I haven't got that at the moment, which of course would then make you feel pretty bad. So then it's coming back to thinking, no, these are things that I want to work towards, or things I want to bring back into my life, even bit by bit. And we may start with just a few moments of it, but then you can build from there. So it's thinking about, well, where can I start, and then build upwards. The third point I wanted to bring up was how, just a simple way of dealing with challenging moments. So the first thing that we want to do is to put the brakes on the worry, because the worry is just like putting fuel on the fire. It all sort of bursts into flame. So we want to dampen things down. And the most simple way of doing that is by using a little bit of breathing. So 4 or 5 deeper breaths. Remember what I said before about the vagus nerve and how that's the parasympathetic, and that's very calming, and all the restorative processes kick in. Well, our immediate access to that is through breathing. So 4 or 5 slower, deeper breaths, just paying attention to your body as you do that, can start to just apply those brakes, give you a little bit of space to think, right, what can I do right now? And if you're in the middle of a storm where there's all this unwanted movement going on, then this is the type of practice that you just need to practice. It will pass. It will pass. That peak will pass. And this is what you can do to try and create that calm. Bring in things that also calm you down as well. Again, it might be music or touch from a loved one or something else. So if you make a plan for your challenging moments, then you can roll it out when you need it. That's an important one. The fourth one is being present, and being present is really important because now is the only time we've got to make a difference. There's no tomorrow and there's no past. They don't exist apart from in our thinking. This is what's happening right now. And something like the mindful breathing or mindful practice is a way of learning to be present. Mindfulness isn't about relaxing or calming or trying to achieve anything or fix anything. It's about being present and understanding where you are and getting a sense of who you are and what's happening right now. But it takes some time, and it's not always easy. But there are some really good apps out there, in particular Waking Up by Sam Harris. That's the one I tend to recommend to people. We practice things in the sessions and I record them for the person, but having a day-to-day app is an excellent resource for that. Fifth one is just around body sense. Again, this is something that you can simply try and see what your balance is like. So with dystonia and involuntary movements, then this sense of where our body is in space is often off key. So a lot of people I see, they find balance very, very difficult. So starting to practice something simple like balance, but putting your fingers lightly on the wall or the back of a chair, whichever feels most comfortable, is a really good way of just starting to get a sense of where you are in space. And once you've got the position, see how long you can hold it for. You don't need to hold it for longer than around 10 seconds, but if you can only do 2 or 3 seconds and then you have to put the other foot down, no problem. Just start with there and then build it up. And of course, you want to work on both sides as well. And with the kind of balance practice, you can practice as often as you like, but you do want to be safe. And the reason why you put your fingers on the back of the chair or wall is because as far as your brain's concerned, that creates a sense of safety. And you'll find that it's easier. If you try and do it in the middle of the room and your balance isn't so good, you'll be wobbling all over the place. And the thing about practice is that it needs to be equality. So the 10,000 hour thing is a bit of a misnomer. It's the quality that's key. Quality practice. So that's a way of starting to build in body sense. And then the sixth tool here is going back to what I was talking about before around this disconnect, which is very common in pain and depression and other conditions, is to think, right, what can I start to reconnect with straight away? What really matters to me? So you've got 3 P's and a B: people, purpose, and the planet or nature, but in the end doesn't work so well, so I call it planet, and your body. And the body sense practices help you to re-engage with your body, but who could you connect with, or what could you start doing, even just a little bit, just to feel that you've got something to get up for and to work towards in your life. Having a purpose and knowing what that is, or purpose is, and being in touch with that is really important for our health. So finally, the approach here, as you're probably picking up on, is very much thinking about what you can do. There's hundreds and hundreds of different practices we can draw upon to move forwards in our lives. You can choose your approach. You've got an existing style, and you will have developed that over the years. But now you can think, well, does it work for me? Or what elements of this work for me? What are my strengths? What brings me results in my life? And how can I use that here? And through focusing on your strengths, that's how you can start to re-engage. We know this. There's huge amounts of data on this in all walks of life in terms of performance. So you can choose your approach, and each morning getting up and deciding what your approach is going to be. But if you put within that approach, right, I'm going to do what I can right now, even if that's just to calm the storm, then you're going to be heading in that direction towards your pictures of success. And what we're talking about here is this growth. We need growth. It's one of the skills of being well, is to be able to grow and develop in a positive direction. Or you can think of it as a route of mastery, where we're heading towards something that we're trying to improve. So in summary, just so you consider your own approach, what's your style? We develop and grow by design. Which way are you going to choose? Focus on what you want, not what you don't want. And changing your experiences really starts by changing the conversation. And the person we talk to the most is ourselves. So we start by changing that conversation we have with ourselves, but then those around us as well. So thanks for listening. I hope that was useful. As I said, I'm going to put out a sheet. I know it was fairly rapid fire, but we want to keep it short and succinct for now, and we can build on that at a subsequent time. So handing over to Sally now, and enjoy the rest of the webinar.
Richmond, thank you so much. That was really good. I know personally the bit that you were talking about with breathing really hit home with me. It's something that when I have to do these things really helps, just that calming breath. So thank you very, very much. Richmond will be available for questions at the end, but I'd now like to introduce our second speaker, Sally Glover. Sally studied at the Coventry University and Brunel University, London, and completed an MSc in physiotherapy, neurological rehabilitation. Sally also completed master's modules in injection therapy neurology from Coventry University and prescribing at the University of Birmingham. The masters have enabled Sally to develop the botulinum toxin service to people with movement disorders and facial palsy, alongside Professor of Neurology, Adrian Williams, consultant neurologist, Dr. Ben Wright, and clinical nurse specialist in botulinum toxin, Jacqueline Montgomery. Sally leads 2 physiotherapy-led botulinum clinics per week and has a current caseload of over 300 patients. She has a particular interest in the multidisciplinary rehabilitation of facial palsy, dystonia, neuromuscular disease, and functional neurological conditions. Sally, thank you so much for joining us today, and I'm going to take it straight over to you.
So, hi everybody. Yeah, that was a lovely introduction. Thank you very much. And thank you to follow on from Richmond. I think that very interesting talk, and I think perhaps I'll follow on in a slightly practical way in terms of the principles behind what we do is very much of what Richmond has described. But we get together as a group. We're a team of 120 physios at QE, and there's 50 of us in outpatients, 10 of us in neuro outpatients, and we're very lucky that we work a lot together. And some years ago, a number of us put our heads together to think about dystonia in a slightly different way. Many years ago, we followed a program with Jean-Pierre Blaton, where one of our neurosurgeons conducted quite a lot of surgery. And I felt that observing these, I didn't actually treat this group, that these patients were getting weaker and weaker over time. And their control of their head, some of it was very, very good, but very, very challenging. So we take an approach, and if we go on to slide 2, Victoria. We thought about people's posture because, as Richmond said, focusing on a body part in particular tends to accentuate the deficit within that body part. So we've gone to look at the body as a whole, and we've used a sort of core strengthening program, which when we shared with lots of other physiotherapists a few years ago, we all got together, and we all, although we didn't know what we were all going to talk about and present about, Richmond was there too, is that we all focused on physicality, on posture and our core stability. The core of your body allows the rest of your body to, your head, neck, shoulders, to gain an upright alignment. And if that goes out of kilter, especially with dystonia, it creates pain, discomfort, increased spasm. The more pain, the more focus. So it's trying to alleviate pain without thinking about the area that's actually more dystonic. If I can go on to slide 3, perhaps to explain this slightly easier. So these 2 patients of mine have cervical dystonia, and we looked at the way it's affecting their trunk. So we couldn't just offer physical rehabilitation to their neck. We focused in, as you can see here, the distortion in their trunk was causing lots of problems functionally, physically, and in terms of pain, spasm, and inability to do their work. And the gentleman on the left was a ballroom dancer, and the one on the right had just got married and was very upset by his image, cosmetic image of how he looked. So they both had an individual goal, and that's really important for physiotherapy of any kind, is that we're looking at what you want to achieve, not what we want to achieve. So it's how you can help you to achieve your goal using the physical techniques that we have in order to improve your function. So for example, another patient wanted to be able to carry her grandson, another one wanted to be able to fit into her clothes better, all things that are really important to them, which perhaps I wouldn't think about as an individual just looking at somebody's body. So the first part of our subjective examination is discussing with you where you're going, and those principles that Richmond described can help you decide where you're growing if you're not got a specific goal, but think where you are now and where you want to be. Can I go to slide 4, please? So sometimes your body alignment, you're not always aware of where your head and neck are in relation to space. So you're not always aware that your head or trunk or it is slightly out of line. It just feels uncomfortable. It doesn't. You're not always, unless you look in the mirror, you're not aware that you're not straight. So we've used some proprioceptive taping. This is just a sticky tape that you can leave on for up to 3 days. It helps you give some feedback in terms of bringing your spine back to the center. This has been really useful for some people because it helps them go away from their therapy program actually in the hospital, and actually then go feel that they're continuing on. They know exactly when their posture is changing because it pulls on the tape, and then they can bring it back. So we use sort of sensory tricks, which I'm sure some of you will have be aware of with dystonia, that any sensory input distraction reduces the activity whichever part of your body it's occurring. We then, alongside your goal, if we go on to slide 5, we devise specific tailored exercises. It's very much geared into where you want to go and what you want to do. Bear in mind what problems you've got. Everybody's got a different perspective on. Some people have got quite marked dystonia, and yet how it impairs their everyday life could be very small. And some people have very minor, what you think might be very minor symptoms. It can affect their life in huge ways. So it's not always what you see. It's very much looking at how your symptoms impact on your everyday life and how we can help you change that. So different people have different levels of physical activity, different muscle memory. So we choose a selected range of 3 exercises at a time. Probably takes around 15 minutes per day. And we change that every 6 weeks. And a patient with dystonia usually comes to us for quite some time, probably up to 6 months every 6 weeks. So you don't have to attend on a regular basis. You're given, we discuss with you where you want to go and how we're going to meet that goal, and we set stages so that you're going to get small changes over a period of time. So you're not going to gain everything in one session. It does take perseverance, and as Richmond says, it is a state of mind in terms of, and it takes practice. Anytime you're learning a new skill, you know that in order to acquire that skill at a high level, you need to practice it. The more you practice, the better it becomes. The better it becomes, the more pain and more discomfort you alleviate. So can I go on to the next slide, please? We focused, as I said, on a lot of core stability, which is fairly easy to do in terms of activity at home. So we've got a team of 3 or 4 therapists that are interested in dystonia at QE. So we're very happy and very keen to help people in a physical manner, as well as it is coaching in terms of trying to create calm, create quiet, and create focus, helping you regain contact with parts of your body that perhaps you're not always aware of, and how you can improve your middle part of your body in terms of strength, which makes your head so much easier to lift. Can I go on to the next one? Once we've gone through a certain range of core stability, we've improved your strength and your balance, we have opportunity to extend that into more of a group nature. And we've chosen Tai Chi and yoga, which are things that are accessible in the community, and we've got links to community groups. We also have a private Tai Chi and group that, because people didn't want to leave us, and we see the NHS isn't available for everybody for the whole time. We have a set number of sessions over a certain period. So for us, it's around 10 sessions, but we can go longer, we can go shorter, because it evens out over time between the 100 referrals we get every month. So Tai Chi is 8 sessions. You can then continue with the private Tai Chi at $6.50 a session, which is comparable to that outside in the community. For example, the yoga is not happening at QE at the moment, but we're hoping to restart that, and we have a Pilates program as well. So we move from an individual into a group. So we've got other people with dystonia that it's nice for people to meet, have a coffee beforehand or afterwards, and that discussion also, I think, helps you centre where the dystonia is for you, how it's affecting other people. You can empathise with each other. It's a bit of a support as well as a physical support as well. It makes you feel good. We don't really see natural endorphins, and you feel like we achieve something by the end of those sessions. If I can just go on to the next slide. So you can see with this young man, he did improve tremendously with a combination of botulinum toxin and physiotherapy. He was very committed to doing just, as I say, 50 minutes per day, which we then got to once he'd reached the end session on the right, is that he could actually do an exercise program 3 times a week and actually incorporate that into more fun exercise than just doing specifics on a bed or plinth or floor. So he came to us for a year, every 2 months, did really, really well, and is a great advocate for what therapy can achieve. But as Richmond says, it is a state of mind of having that goal and being very focused on where you want to be and where you want to go. So that commitment is twofold from us in terms of helping you achieve those goals, and from the commitment from yourselves in terms of committing to a 15-minute program. It would mean not necessarily 15 minutes all at one time. It can be a short, sharp, while the kettle's boiling, do a little something, while you're cleaning your teeth, do a little something. So it's very tailored into what builds into, what's easiest to achieve in part of your day. So practical tips that you could try from this session. In lockdown, obviously, this is a different ball game. We're not seeing people practically in the department to try and avoid any increase in COVID contact, from more protecting you than us as staff. So because all of us are working on the wards now rather than outpatients, all outpatient services are closed at the present time. So we're trying to work with Zoom and video at the QE, so we can help actually have video sessions as well, a bit like Zoom for Richmond. So we can actually see people and actually take their exercises to the next level too. That's going to start probably in June for us, when all our staff come back from the wards. So if I go to the next step, a little practical tip to help open up your chest and help your head and neck relax is to roll up a towel, place it on the floor with a pillow at the end or a rolled up towel at the end. You sit on the floor with the towel at the base of your spine and lie down over it and stay in that position for around 5 minutes. This can be helpful for people who don't have, obviously I'm giving you advice based on generalist advice. For those people that find it uncomfortable or painful, then you should really seek help from the person who's helping you at your neurology clinic, or indeed your local physiotherapist or your GP. So these are just top tips that you can try, but if they're not suitable for you, then think about something else. Can I go to the next one, please? This is one that's helpful. These are aimed at cervical dystonia at the moment. So a tennis ball underneath your chin, sitting in a comfortable chair or with your head against the wall. You put tennis ball under your chin, squeeze down onto the tennis ball, and it takes your neck backwards, correcting your posture and taking the pressure off of your cervical spine. Now, obviously, this is an exercise that's suitable for some people and not for others. So I'm going to give you a range. The first one, lying down on your back, just helps ease the pressure off your thoracic spine, which is your upper spine before in between your neck and your lower back. This one you can do in a sitting posture or standing while you're waiting for the kettle to boil. Just have your tennis ball on the side. The next picture, if you can't manage a tennis ball, then you just, this is following on from Jean-Pierre Breton's work, is that you pop a finger on the end of your chin, you tuck your chin in, and you hold that position for 15 seconds. You try to look ahead, not down. And it just brings your head into more of a midline position, takes the pressure off the back of your neck and the upper trunk, but also as you take your weight back, if you're doing it in a standing position, the weight goes from the front of your toes to the back. And so instead of thinking about what's happening in your head and neck, think about what's happening in your feet. Feel your feet on the floor, feel your weight going to the back, and that will activate all the muscles of the lower back of your lower part of your leg and your bottom, and help you again take the pressure of your head, upper neck and upper chest backwards, making it a lot easier to stand more comfortably. If I go to the next one, another top tip, these are things that all patients have tried that have been proved to be very helpful. Putting 2 tennis balls or small balls in a sock, putting them on the floor, on the bed, putting them beneath the base of your head, top of your neck, and there's 2 little muscles in this area that your balls will come in contact with that get very, they can go into spasm when you're under tension. They can cause headaches and discomfort over the top of your head. So you can relieve a lot of discomfort around your head and neck if you just rub over that area. As it says, for around 10 seconds, repeat just once a day, or as often as you, well, we're all in lockdown, you're going to need things to distract you, perhaps more than you would do if you're not working, or you're working from home, or indeed you're retired. So there's little top tips that you can do to think about positive ways to help rather than perhaps more negative, which we can all are guilty of at times when you're in discomfort. In terms of, can I just go to the next slide, please? So practical tips at home for your face and eyes. We found that acupressure points can really help release tension around the eyes and face. These are fairly easy to do. I wouldn't say some of them are comfortable, but it's not a case of no pain, no gain. It's just gentle pressure over the points that are on the diagram around your eye, hoping to relax the tension in your eye. As you could practice your breathing exercises while you're applying the pressure, and as you reduce your heart rate, as create calm, as Richmond stated in his first slide, is that you can reduce the amount of blinking that occurs. So it's creating calm, finding ways to create relaxation and reducing stress to reduce activity within the muscles. Can I go to the next one, please? Facial massage is another way of trying to gain relaxation, taking tension and focus away from various parts of the face. We start with a minute in the forehead, a minute in the cheeks, a minute around the temples, and a minute on the chin. So it's a 4-minute program to be carried out once a day. It's very relaxing as you're doing it to yourself. People often report that they feel as though they're doing something positive, they're distracting away from the tension, and they feel better once they've done it. It feels really nice to have your facial muscles massaged, especially if they're tense or in spasm. there's a little sheet which I've sent to Victoria, which for those of you that would like more help on this, you could download, and it just goes through the pictures with a short written description. Can I have the next slide, please? And one key thing, as Richmond said, is creating calm and relaxation. So the key here is to, we know that dystonia can be increased or enhanced by stress and anxiety, and it's trying to find a place where you can create calm. This is more for facial patients, but this works generally for other patients as well, is just popping your hands onto your face, letting your elbows drop down to the floor. The pressure, you apply gentle pressure to your cheeks, close your eyes, and you focus on releasing any tension, firstly around your forehead, then around your temples, then around your eyes, letting your eyes fall into the back of the sockets, into your cheeks, jaw, chin, and neck. And we suggest holding that position for around 5 minutes. Nice deep breathing, 4 deep breaths at a time. As you relax, your breathing becomes more slower, and you can feel more in control. I think perhaps is how patients describe it, that I've treated in the past. Can I go to the next slide, please? For those of you that perhaps need a little bit more in terms of pain relief, this is patients giving us top tips on what's helped in terms of heat packs. For neck patients, any spinal pain, you can use heat packs. You can stick on the Cura heat packs. You can use reusable heat packs in an area. We know that if you generate heat and increase the circulation to an area, it will then bring new nutrients, increase blood flow, and take away any toxins that have been produced by muscles that have been in spasm for a while, and it can help that muscle relax. The same with the acupressure. You put pressure onto an area, it reduces the blood flow. As you take the pressure off, the blood flow rushes in, taking away toxins, increasing good blood flow to the area, more nutrients, relaxation. The knee patch is used for dry eyes, but it's very useful for relaxation when you're if you've got blepharospasm or hemifacial spasm. You can put it in the microwave to warm it up, and it's got a temperature scale on it, or you can put it in the freezer and have it cold, or put it in the fridge. So you can, some people prefer warm temperature to relax, some people prefer cold. So it's trying to gain something that gives you control over your symptoms, rather than thinking about the state of mind as thinking, right, when's my next injection? You know it's coming, and the week or 2 weeks before. So you do really, the common feedback I have from patients is, yeah, it's back. I said, but okay, let's go through the last 14 weeks or 12 weeks, 16 weeks, whatever their timescale interval is. And once the botulinum toxin starts to increase and you start to get that relaxation of the muscle activity, then your function can be, for some people, is back to normal. But it's only when you've got that date to come back to that you're considering, then you focus then on your symptoms. Some people we've given people a slightly longer break. This will be an enforced break this time, but it's important to think about, if you were doing a diary, how different is the session? Some of my patients have been now waiting since April or end of March, so they're around 6 weeks behind, and it's only this last week that they've actually started to get in contact with someone. So what's it been like over those last 6 weeks? They've lasted, now some of those people have lasted 16 weeks. So we've got to be thinking a bit more positively in terms of, if easy for me to say without dystonia, I'm just trying to think about the state of mind and create the best possible environment for you guys out there whilst you're waiting for those clinics to resume, and having strategies to help yourself, as well as the biomedical model where you're receiving medication or botulinum toxin. We found that toxin and exercises by far superior to anything else, but that's because maybe that's what we've experienced most. Botulinum toxin and exercises give people able to the means to achieve their goal. And I hope that some of these top tips might be useful to you in what can be a stressful time for everybody, in a way of trying to control that stress and just reduce that anxiety and reduce that discomfort. So, and my last slide. So, for any of those that might be interested in learning more about Jean-Pierre Bleton's work, there's a book that was modified 2014. You can still get editions of that book, and it's very patient friendly. You can understand. It's not written for it's written for therapists, but in more of a layman's terms that anybody could have a go at without the support of a therapist, providing you're in generally good health otherwise. Okay, so I'd happy to answer any questions that you have, and thank you for listening.
That was amazing. Thank you so much. I think there's some really great top tips in there that people are going to take away and really enjoy and use and find useful. So I know we're running a bit tight on time. We do have some questions. Richmond, Sally, if you're all right with us just running through a short amount of them. So the first one we may have already answered is, do you have any exercises to help if the head leans forward? And we were wondering if the tennis ball exercises you mentioned would be good for that, Sally.
Yes, and if they can't fit, it's whatever size ball you can fit in. If they can't fit a ball in because they're too far flexed, then to use your finger and try it in. If people can try it in sitting, they can try it in standing, they can try it in lying, whichever their situation is easiest.
Brilliant. So question number 2 is, what are your most recommended physio stretches and strengthening exercises for cervical dystonia?
Maybe I'll just make a comment on stretching, because it's quite everyone has their own ideas about what it is, and so you've got a stretch where you might lean over and hold in an attempt to elongate certain muscles or structures there. And then you've got more of a lengthening technique where you might just work sort of into the range. Now, it kind of depends on what you're trying to achieve. If it's just a general sort of nourishing movement that you want, and that would make up the bulk of what you're doing through the day, bearing in mind muscles are working hard, they're building up with lots of chemicals, you want blood and oxygen pumping through. So you just want nice, easy movements. I talk to people about dancing with your body rather than trying to force or work against.
Yeah, very much so.
So it might be just a little bit of breathing first of all, and then just to focus, and then just some simple movements in whatever directions. And actually a range of directions is good. In terms of strengthening can only really come over the top of having a better sense of normal movement. Otherwise you're just going to reinforce and kind of perpetuate potentially the prediction of movements that you don't want.
Right. Okay, thank you. Question 3, do either of you have any advice to, and I think this is probably something that we get asked a lot, do either of you have any advice to improve mental health during times when spasm prevents normal levels of activity or might prevent you from doing the exercises covered today?
Mental health, I would go for more relaxation and trying to perhaps download an app like Richmond suggested that could help you, guide you through more relaxation, which would reduce the spasm. So trying to overcome some of the spasm via more of a mind control.
So mindfulness technique.
I think also it's important to raise the fact that mental health sort of implies that there's this separation between mind and body, which there is. This is a false dichotomy. This is a way of thinking which is Cartesian, 400 years old, and we know fundamentally when we examine our own experience that there's just one of those, and so your mind is embodied. Your mind isn't here. It's not in the brain. We think with our body. We actually create our own perceptions by the way that we move. And that's why when we have an issue with movement, the world starts to look different, and our relationship with it and others starts to change. So if you detect that you're in some kind of unwanted state, so maybe your mood's dropping off or you're feeling anxious, now we've got to qualify that these are normal states as well. And there's some kind of message, there's some kind of need here that's to be met, a bit like hunger or thirst. That's quite a nice way to think about it. So if you're not feeling great, you could be thinking to yourself, well, what are my needs here, and what can I do to build my energy, or what can I do to feel better? So it's really about the questions you ask yourself. You know, the quality of our lives is largely governed by the questions we ask ourselves, and that I made reference to changing the conversation. So instead of thinking, oh, why do I feel so bad? Well, how can I feel good? Now, of course, that sounds really simple and quite trite, but it takes training, and sometimes having little cues or prompts or notepads or stickers around just to try these things can be a useful first step.
Okay. When looking for physiotherapy programs, is it important to work with a physiotherapist, who understands dystonia, perhaps versus somebody who hasn't seen any dystonia patients?
Yes, where possible, I would say, or chronic pain.
Yeah.
Okay.
Yeah, for sure. They're both specialisms in their own right. I think that for various reasons, physiotherapy is often just clumped together. Oh, you're a physio, but actually, no, that's really not true. You know, both of us, Sally and I, we have our specialist fields, and we spend a long time studying and working in that area. So think about, you know, if you had a problem with your boiler, you wouldn't ring up a carpenter.
Yeah. Yeah, so if you can possibly find someone that has had that experience, that's much better.
Yeah, for sure.
Okay. I don't know if you can answer this now, but we'll ask it. Do you have any advice or exercises for somebody who is normally quite physical, but obviously at the current time are less able to be sort of out in the world and physical? Is there anything you can suggest that people can do more in-house?
It's quite a broad question. It would very much depend, I think, on what that person's physical activity was. You know, I think I'd struggle with that in terms of that. I don't know, Richmond, if you've got anything more to add than that. I don't.
Yeah, I mean, it depends on their situation. If you've got a garden, great. I mean, just a recent piece of work came out talking about, you know, getting into nature and the importance of that, or you've got a local park where you can walk to. It's, you know, for various reasons, our levels of activity may be impacted upon by what's happening in society at the moment, or by your own condition. And again, it's trying to think, well, what can I do? What could I do, even if it's just getting up and walking around, or going up and down the stairs a few times, or sitting in the garden and doing some breathing. You know, what can I do? What are the possibilities here?
Yeah. Okay. So this is a question for Richmond. What are the most helpful techniques to overcome the psychological effects of expectations if the mind naturally does this?
Yeah, I mean, that's a great question. I think the best example of that is what I call the 12-week thing. So as someone's coming up towards that 12 weeks, you know, all this sort of expectation of, and this sort of often desperation of getting to that point, of course, then you're not present. And so the main, well, going back to what I said before about trying to see the whole, I'm a whole person here. This isn't a psychological thing. You know, there's a body and there's biology involved all the time. But the practice of trying to be present, trying to be in the now is absolutely key. There's a slight issue in as much as we've been flooded with the mindfulness sort of revolution, and unfortunately a lot of the messages out there that have been dumbed down. But the essence of it is the presence. And, you know, there are some really helpful people out there and lots of resources on YouTube. So people like Eckhart Tolle, for example, talks, you know, a lot about the presence. People like Thich Nhat can be great, and Pema Chodron, excellent on simple sort of ways and techniques of using that. But they usually all come around to saying, use the breath.
Okay. It's amazing how much breathing makes a difference, actually. That to center yourself, isn't it?
Well, it's our
Huge.
way of gaining control over the autonomic nervous system. I mean, there's hundreds and hundreds of different breathing techniques. So, you know, one of the most calming is to double the out breath. So, for example, breathe in counting to 3, breathe out counting to 6. But it's important to pay attention to what changes as well in your body. We can often be distracted. So trying to really notice, and maybe you just start by doing one breath if you find that your focus is going all over the place. And then once you start achieving that, then you do 2 and 3 and 4 and so on.
Okay, we've just got a couple more quick questions then. Are you aware of any physiotherapy clinics such as yours, Sally, sort of elsewhere around the country?
Yes, but we've got a small network of therapists that are all over the UK that are interested in dystonia. So I'm not sure, I will check with the British Neurotoxin network on how up to date that is, but you should be able to go on the British Neurotoxin website and be able to identify. You hover over a map, the Google map, and it will tell you which hospital has a specialist who's interested in dystonia, not just for injections but for therapy as well. So I'll just check that is up to date. I haven't checked it for a while, so that's a good thing for me to do.
And the final question is, I guess for both of you, how important is it to practice the techniques that you've both covered today on a daily basis? Is weekly good enough, or how often should you practice? Like I assume it isn't hourly, but is it weekly? Is it daily? What would you suggest?
We usually ask our patients to start with to do it daily, so you're getting into a routine. Because that's got to be a focus. It's got to be part, you've got to build it into part of your life. And we found that unless you do it on a daily basis in the beginning, you've only got an hour with somebody. So we need them to focus, be committed towards, because it's their goal, not our goal. It's a joint goal because we're helping people get there, but it's the actual individual's goal of being where they want to go. So it's having that commitment on both parts. So we would encourage people to do it every day, if not every day, every other day. But usually we try the first 6 weeks to go every day. It seems a lot, but it's only 15 minutes. So it's not like you've got to do it in 15 minutes at a time. It will be, we have some people that put a little post-it. So you have one on the fridge, on the mirror, and it's just like stand tall. It might be something as simple as that. Just stand tall, and there'll be a technique of how you check if you stood tall. So it will be something very simple. Maybe put your weight on your heels when you clean your teeth. You clean your teeth for 2 minutes. If you've got an electric toothbrush, you can time it. So it's very simple techniques, but we want it to be part of every day. So you're checking your alignment, you're making yourself more aware of your body and taking more control.
And Richmond, for your stuff as well, daily?
Yeah, no, absolutely. No, I agree with all of that, of course. There's 2 things. I mean, one, the quality of practice is key. And Sally said, you know, the focus on what you're doing, and doing something once is better than not at all. But we're also talking about habit formation. And habit formation, it's not created by doing it X number of times. It's by doing something and feeling good about it. It's that positive emotion that comes with it. I mean, look how quickly you give someone a phone and they form a habit. I mean, it's instantaneous because they feel good about it. So if you set the bar at the right level, so it's achievable each day, which may be 1 or 2 or whatever, and we can explore that when we have a conversation. What do they think is realistic that they're going to do? And then so they hit that point every time. They can do more, of course, but they hit that point, so they become this person who, in their narrative, I'm someone who succeeds, and that motivates them to do more. But also the second point is you've got to acknowledge your success. You've got to reward yourself in the sense, or celebrate that moment. Oh yeah, I've done that. I mean, not necessarily popping open the champagne, but just some kind of acknowledgement to self. That actually, that feels good on the basis that I've done it. And that positive emotion is what motivates us to do it again.
Brilliant. I mean, guys, I can't thank you enough. You've both been amazing.
You're welcome. It's been a
Great,
pleasure.
thanks.
Thank you for inviting us.
Oh, you're more than welcome. And I'm fairly sure that everybody watching will agree with that. So we'd love to say a huge thank you to both Richmond and Sally, and of course to our sponsorship partners for this webinar, Merz. So thank you very much, all of you.